With tens of thousands of coronavirus cases worldwide, including at least 80 here in the U.S., the federal government now trying to reassure the public it's prepared.
We will have more, and we will have more community cases. It's simply just a matter of math.
The CDC now says it will allow hundreds of labs across the country to test for the virus, to more quickly identify potential patients and track transmission.
We now have 75,000 tests available out there in the United States, and over the next week that will expand radically on top of the 75,000 tests available.
But fear and misinformation continue to spread. Across social media, many, including some celebrities, have posted photos wearing face masks. Health experts say that's sending the wrong message. The Surgeon General tweeting that people should stop buying them, explaining masks are not effective for general prevention and need to be reserved for healthcare providers and those already sick. To help with demand, 3M is now increasing production to 35 million masks per month. In corporate America, it's anything but business as usual after the stock market took a huge hit last week, the biggest decline since the 2008 recession. And with fears mounting, giant companies, including Goldman Sachs, JP Morgan, and Amazon, are telling workers to avoid unnecessary trips. The auto industry is in trouble, too, scrambling to find parts and prevent shortages, facing delays from Chinese supply chains. And now experts predict car sales could fall by as much as 2.5% this year. Some conferences around the country also canceled. In Texas, a global energy gathering expected to bring thousands from more than 80 countries to Houston called off. Worldwide, travel is taking a massive hit as well. Delta and American suspending flights between the U.S. and Milan, Italy until late April at the earliest. United halting some flights to Japan, Singapore, and South Korea. Meanwhile, retail is hurting, with international flights being held up and shipments delayed. Even some brides-to-be scrambling now to find wedding dresses before their big day.
Yikes. You paint a pretty grim picture there, Mr. Costello. But here's the thing. If the elderly are most at risk, how are officials explaining those relatively young doctors who died over in China?
You know, I asked that exact same question of Dr. Fauci at the NIH because we had several 30-something doctors in China who died of the virus. And what he said is, listen, for the typical young, healthy person, it probably is not going to be a fatal risk. But these doctors were at the epicenter. They may have had very high viral loads surrounded by the virus. That may have put them at greater risk. They could have had an underlying health condition, but just the surrounding, being surrounded by so much of the virus at the epicenter may have proven to be too much for them.
And on the flip side of that, Tom, some are saying, people who've actually had this virus, that the symptoms were rather mild.
Yeah.
Yeah, no, we've heard from people who have had or have the virus, and they've said, listen, I had a tight chest, a little bit of a respiratory distress, but nothing significant. Didn't even think about going to the doctor. No fever, no chills, no aches. And listen, for most people, the advice is they can take some ibuprofen, and they will probably get through it just fine. If they have to go to the hospital would treat them with fluids, with ibuprofen, and whatever you would normally do for somebody who has the flu. But there are no antivirals, of course, right now for this particular strain of the coronavirus, and no vaccine, which makes it really dangerous to those folks who are maybe 65, 70 and older. Guys, can we make one important point?
Yeah.
So far, we've had 2 cases here in the United States, 2 fatal cases. We have somewhere between 18 and 40,000 people who die every year from the seasonal flu. And so it's important to put that into context.
Perspective is important. Thank you, Tom. I'm glad Tom included that part about the masks, too.
Yeah.
We've been traveling a lot over the last few days, and you see people, wearing these surgical masks.
Well, not only did they say that's really not effective for what people are hoping but as the Surgeon General said, it's the health professionals who need those masks, so you don't want to go
wasting them.
Yeah, exactly, wasting them.